Welcome to episode 5 of my free 6-part video series regarding my back masterclass. And in this video, I'll be discussing amazing testimonies of my recent graduates of my back masterclass program who finally regained their life without back pain and a stronger core and improved posture. My recommendation is please watch episode 1 before proceeding to episode 5 as we're going to slowly progress and strengthen our deep core muscles. Hi, my name is Annie. I'm a physical therapist with more than 20 years experience, and in this video, I'm also going to demonstrate how to use the ball and the foam roller and elastic band to finally activate your deep and weak hip muscles and your core, your lumbopelvic hip complex that I've been discussing in the last 4 of my videos. So the first graduating student is Marisa from New Jersey, and she has been suffering from scoliosis up to 60 plus degrees of curvature, dextroscoliosis for many years. Actually, she also has a reverse S curve. And because of this, she has difficulty taking care of her kids, and her lifestyle has been a lot of pain with her kickboxing hobby that made it difficult for her to enjoy her hobbies. And now, after a few weeks of my therapy, she's finally feeling her muscles that she never felt it before, that's needing some love, attention, and detail. And she could finally enjoy her life going back to kickboxing without fear of hurting her back. So let's watch her amazing testimony.
On the first one of week 2, my neck felt so long. It was like a giraffe. I was like, what?
That's amazing.
I know. I was like,
you didn't realize
I feel so tall.
And that's true. You didn't realize you've been leaning on one side, I think you're leaning on one side.
Yeah. I love to feel like, I don't know if I told you when I had my surgery, I was 4'11", and when I came out, I was 5'1.25". So there's still some curve here. So I'm excited. Maybe I'll get a little bit taller.
Yes, actually, I have a 70-year-old patient. She did 3 months with me. She had to follow up with the doctor, and she grew an inch.
Yeah, it's amazing.
And she's 71, and the doctor was shocked too because it's the same yearly exam.
Yeah.
Same measuring, they didn't have a change. And she grew an inch. She didn't realize she was too forward. Every time they measure her, she can't stand straight because she's in a lot of pain on her back.
Amazing.
It's amazing. And she has compression fracture, by the way. Like, they can't touch it. There's their surgery on her.
I felt like bubbles.
Wow.
Like crunchy, kind of.
Yeah, releasing. Yeah.
And it was like, woo.
Wow.
It was nice.
I'm glad.
Yes, I made notes on everything to know, like, if I need to feel, stretched out, I need to do that. Or like some of them, I got a crazy release in my lower back that I did not expect just by doing over to the side.
I'm so proud of you, Marisa. Thank you for writing it down and expressing for a group to encourage, because everyone's different journey.
On week 2, class number 7, with proper breath. My notes were, I felt more connected with my upper and lower body, which, with the scoliosis that's a big thing.
Yeah.
I normally don't feel that way, and I felt like a whole skeleton.
Wow. The whole vertebrae body. We have 23 of them. How do you find the program so far, Marisa?
Amazing. I've been following you for how many years has it been that you've been on here?
5 years.
I've been following you for a few years, and I've done most of your videos. And I feel good. I feel like you know what you're talking about, and it makes me more confident to follow someone that, you've been through your own struggles too. You can talk about that. You do talk about that. And that's really motivating for us.
And then with your scoliosis, I know you have, how many degrees of scoliosis you have?
67 degrees.
Yes. And despite 67 degrees with a rod, just it's okay to share to our followers. How do you find your
I have 2 rods and 14 hooks, screws, and bolts.
And follow through with everything all the way to week 7.
Yeah.
Proud of you.
Yeah. I took my time and did the work, and I feel good.
Yes, and from the first 3 weeks, remember.
I feel whole because of my scoliosis. Like I have this area that doesn't bend. It's like a broomstick. I tell everybody, and so I feel like my upper and my lower parts were kind of moving differently, not
Yeah.
not together. And I definitely feel like it really is the first time that I feel my spine from the top to the bottom. It's not broken up. It's connecting the top and the bottom and the middle, and it's like one spine. It's great.
Yay. I'm glad you love the program. And the beauty about this program is it's easy. It's not hard workouts, right? And it's a lot
Yeah.
of connecting from simple breath work and mindfulness. Thank you, Marissa, for sharing your testimony. I'm glad.
I have one more thing to share about the breath work, which is, something that other people might not find too exciting, but I was really excited. This past week, we decorated my sons. I'm a room parent, so we decorated their classroom for Valentine's Day, and the one room mom brought a whole bunch of balloons, and it was late, and I was like, all right, I'm gonna get through these balloons. I'm blowing up all these balloons. This is a weird thing to share, but I blew up like 30 balloons in less than 5 minutes, and my cheeks did not hurt. It was all in my core. It was just like I was pumping it up like I was the air pump. It was amazing. I've never ever blown up balloons. Like, it's a weird thing, but that's those little things that we get ahead. You notice. So that was pretty cool.
Thank you for joining the back masterclass. Isn't that amazing how Marissa, who has been suffering from major scoliosis with surgeries and still with more than 60 plus degrees of curvature, is finally feeling taller, stronger, and healthier. And the next amazing testimony is my student named Kim. Kim is a lovely student who's had a lot of scar tissue post-surgery on her hips, and she needed a lot of hip strength, core strength, in order for her to work in a prolonged standing position. She stands all day at her work, and she had difficulty engaging her core muscles. And after only a few weeks inside my back masterclass, she finally felt her hips are activating, her core is stronger, and the one-sided weakness of her hip pain finally fixed. And she even said this is the strongest, most toned body she ever had. Watch her testimony. Say hi to Michelle. Glad you're feeling good.
Hi.
How's everything with the week? Let me see. Michelle's doing well. I think you finished you're week 4 and you're doing week 5 already. And that's good for your hips, the PNF pattern, the standing one, right?
Mm-hmm. Yeah.
It's like a ballet.
I was doing a lot of the week 3 only because I got so confident with the movements, and I really started feeling, that's when I really started feeling results, and I kept doing week 3 because I don't know, it was building my confidence. So I had to kind of make myself get into, I look forward so since I've been doing more of I don't know which one, I think it's week 4, I think is the one where I'm really feeling the core. I'm really
good. The one you're lying on your stomach?
I've never felt this sensation in my abdominals before. This is awesome. Yeah. It's a good
feeling. Great news. And it's not high level, not jumping around. You feel good.
No.
And your hip muscles are getting stronger in your standing position at work?
Yes, the hips have been strong for a while. Yeah. I just now started doing I think it's week 4 where you work with 2 of the bands at one time.
Yes.
Yeah.
It feels good, right?
Yeah, and I'm not a very coordinated person, so it's very challenging to me.
I know.
The mind-body part is very challenging. Holding the poses and doing what I need to do with my body is actually pretty easy. It's the mind-body coordination. Yeah, but I love it.
That's good. It's like we're dancing together, and then that's why it's unlimited access. You can always go back, relearn, and don't forget to go back taking care of our health despite our busy lifestyle. Like, I'm always in the gym. That's where I do my yoga and Pilates. At home, I'm just cleaning so much. You know how it goes with our household chores. Sometimes you need to find a space. Could be if you have your own. Before, it's my studio up there, but I've been going to a studio outside now because it's much more better ambience. Sometimes it's a psychological thing, right?
Sure.
That's great news, Michelle. I'm so proud of you. That's so exciting. I'm getting so excited because these are my amazing students who are attending a lot. I could tell who's gonna win and get the valedictorian that I said before.
It's the hip pain that I was having, the awful spasming that I was having at work after standing all day. That is not nearly what it was.
Wow.
Yeah. So that's what I'm kind of measuring it on. It doesn't burn and knot up really bad in my hip. And so that is almost gone. It still gets achy, but my body, I'm starting to feel, I've never been toned like this before. So I'm starting to realize how the different muscle groups are supporting each other. So there's strength from the inside out. So it's a wonderful feeling.
Wow. Good job. Thank you, Michelle. I love your feedback. I appreciate it.
Yeah.
I'm glad you're seeing results because I know you were so concerned before joining. I remembered if this is going to work for my hip fascia. I remember you emailing me before you signed up.
Yeah. It was very painful. But yeah, it's a lot better already. Just, I think.
Wow.
Yeah.
Good job. And you went to therapy, right? You went to a therapist before?
I went to a chiropractor and they didn't tell me anything about muscle health.
Yeah.
And
they just crack you.
That's all they do. Yeah.
Unfortunately, I believe in because it's sometimes because of the manipulation, it just gives you relief, like a little bit, and then of course without the muscle, then of course everything they did, the high impact. It's like we call grade 5 mobilization. We do that. We mobilize too the joints of our patient, but we got trained also a little bit grade 5. But I love just a grade 1 and grade 2 because grade 1, grade 2 is just for pain relief. There's still results with grade 1 and grade 2. And then you exercise after I mobilize. So that's why. And one quick grade 5 usually when I do grade 1 and grade 2, I spend 5-10 minutes in one joint.
Yeah.
But with the manipulation, it's just one quick one and that's it. It's fast, 5 minutes, 10 minutes, you're done. That's why physical therapy, you're there for an hour. If you experience physical therapy, you should be there for an hour with a great therapist who really spend time with you. If you decide to have that mobilization for your hip someday, which is a good idea to have someone touch you if you like. If you feel like you want to get the ache to get out of that hip. Because sometimes we need that manual. Because when you do manual, you're increasing blood flow on the area. And then when you have more blood flow, you're healing deeper. But of course, when we stretch, when we mobilize our own body, that's why you're going to love week 6. You're doing your own mobilization with a foam roller. So when you foam roll, you increase circulation on the fascia between your muscles, fats, and skin. We have fascia everywhere. Fascia is like our t-shirt and clothes on top of everything. Even our bones has fascia. Without fascia, our bones, ligaments, and tendons will be flying everywhere. But when your fascia is too tight, it's like wearing tight jeans every day. If you're wearing tight jeans every day, that's terrible. You can't breathe and you can't bend. So I'm glad you're doing better on that fascia on your hip. Okay, let's say hi to Marissa's bending forward. Say hi first loudly.
Hi.
Hello. There you are.
Wait, I want to agree with Michelle what she was saying about like how she's feeling the progress, and like the muscles supporting each other. I can definitely feel, and I've been doing, all kinds of stuff for years, but I've never felt like muscles supporting each other like I do now, and like kind of like wrapping around, especially with like my ribs with the scoliosis. Yeah. I never really felt so much support, and like I can kind of visualize now how the muscle is, how it's stretching, what other muscles it's covering and stuff like that. It's pretty cool. So
wow, thanks Marissa. I love that. I'm glad you're finally feeling where the muscles needs to be more supported and building strength. I'm so proud of you. You're very good. You're advanced on our course. And I'm hoping you enjoyed these lovely 2 ladies' testimonies as they regain their life without back pain to have a stronger core and improve overall posture. So in this video, I'll show you how to activate your one-sided weakness utilizing elastic band, foam roller, and a ball. So with the elastic band around your thighs, this is a great way to help activate if you have scar tissue in your hips or hip surgery, labral tear, hip replacement. It's not too late to balance one-sided weakness. So if your weaker side is your left side, you can use the ball to lean on for support. So most patients with back pain, they can't lean without the ball on one side because they're so deconditioned on their core, their obliques. And the ball is one of my magic formula that really helps to start moving your body. And the good thing about the ball, it just not just support you, it also proprioceptive gives you feedback on how to feel your muscles start working again with breath work that I've been discussing from episode 1. So with your knees bent, hips level to your shoulder, hips level, stack up together, knees stack up, and hands up pointing to the heavens for a deeper activation. If you're absolute beginner, my recommendation, you can hold on to the ball. I'd rather you have support so you don't fall off. Most patients have a lot of weakness, and making sure you are on a ball that's proper suited for your height, weight, and you can reach on the ground. You don't want a big ball that you can't even place your hand, or too small of a ball, then there's no support. You want to make sure you're a little bit 45-degree angle, knees bent, and with the feet together, lift your hand up and your knee out to a clamshell. So this activates your obliques, your deep core, and your hip external rotators as you breathe out. Inhale, knees together, hands down to the ball. Breathe out, open. Inhale, down, exhale, open. 3 more. 2 more. Last one, my friends. Well done. Now with your leg extended, I have the foam roller for support. For most of my patients, they can't put their foot down because they can't balance. But the foam roller will give you that nice proprioceptive feedback. It's a little bit slippery, so you want to make sure you really hold on tight with your knee and your hand, because this will give you a lovely sensation as you roll, bend, and extend. Inhale as you bend, exhale, extend. Inhale. And now, after mobilizing your hips with your leg extended, so if this is your concave side, you want to make sure you're on the other side to open that side. So this is usually when you're leaning on here, this is your convex, this is the concave. You want to open that out. For scoliosis, open that concave as you breathe out. Inhale, expand your rib cage. You want to make sure you're not breathing through your chest. You're expanding laterally. And then your diaphragm going down to expand your abdominal. And then exhale, squeeze. Open that concave. Exhale. You are strengthening your convex, because the convex side of if you have scoliosis is also have imbalance. So if you have that shift on your body, even though you don't have scoliosis, with back pain, you find you look like you have a functional scoliosis, which means your spine is straight, but your muscles are imbalanced. Usually the tight side, you need to open. You need the weaker side needs to be strengthened by stabilizing it, by leaning on it. This helps support and balance your body, and this side that's really tight needs to be open. And the gentle progression is lifting your foot up with your knee straight and hand up to the heavens, and breathe out. So the band helps strengthen, and then inhale as you go down, exhale, lift. 2 more. Last one. Well done. So that's how I establish some of my videos inside my back masterclass, where I open that one side, loosen up that side, strengthen, stabilize. So you have to find the root of your problem. And once you find which one works for you, you're going to find the right solutions that you can do every single day, 10 to 15-minute workout to slowly strengthen those weak hip muscles. I'm hoping you enjoyed my episode 5. There's so much more to learn. There's one more video where I'm going to discuss most of your questions, asking me what's the course about, why there's equipment, and who is this course for. Please watch out episode 6. And I'm also going to demonstrate more lovely exercises to isolate, strengthen, and establish a strong core, back, and overall posture Don't miss out episode 1. If you miss it out, this is episode 1 and this is episode 2. And follow along until you can reach this free 6-part videos series exclusive just for you. Until my next video training, always remember, be safe, be well, and healthy you. Bye!